Hi guys, this is part 2 of our bloodborne pathogens. All right, in our last video we talked about what a bloodborne pathogen is. All right, remember it is a germ, a microorganism that is found in our blood that can spread disease from one person to the next. Okay, we talked about our 4 different types of transmission. We have direct, indirect, vector-borne, and respiratory droplet. Okay, then we start talking about some conditions where you have a virus or a disease that is spread from one person to the next. And we talked about hepatitis. We talked about hepatitis B, and we talked about hepatitis C. So today we're going to talk about another condition, all right, which is a little bit more well known. Okay, we're going to talk about HIV and AIDS. Okay, so going back to your slides, we're going to start on HIV. And HIV stands for human immunodeficiency virus. Okay, immunodeficiency, big word, but it just means that your immune system is lacking, it struggles. Okay, so with HIV, okay, there's a lot of facts out there. Sometimes HIV and AIDS kind of get confused for one another. Okay, so we're going to kind of keep those two separate for a second. All right. With HIV, it is an infection, all right, that is caused by a virus that invades your normal healthy cells. Okay. For a little HIV fact for you, to date, around 65 million people have been infected with HIV. Okay, and I'm willing to bet that that number's probably a little old. Okay, I bet you it's even more now. Okay, you can see the stat that we have here. Okay, the World Health Organization said that there's an estimated of 42 million people living with HIV or AIDS in 2004. 2004 was a very long time ago. Okay, so I want to know, do you think that 42 million is outdate because it's higher now, or is it, do you think, lower? Okay, so kind of just think about that for a second. Okay, HIV is spread through sexual contact, okay, or coming in direct contact with the body fluid, okay, and that can be blood, okay, but most of the time it is semen, okay, so coming in contact with the body fluids. So signs and symptoms, okay, fatigue is a big one, all right, just not having enough energy, you're just kind of overly tired. Weight loss is a big sign. Okay, and it's kind of dramatic, all right, dramatic weight loss, and not without you trying. You're not trying to lose weight, all right. There is muscle and joint pain, okay, but a big key is night sweats and fever. Okay, having night sweats and fever are kind of a big thing that people look for, all right. HIV antibodies can be found in a blood test, and what that means is that disease is present in your blood, and sometimes it is not noticed until about a year after that contact. Okay, it's not something that shows up immediately, and it can, but sometimes it can go unnoticed for about a year. Okay, and until it starts showing up in your blood. Okay, about 45% of newly infected individuals are between the ages of 15 and 24, and that is all of you, okay, and most of the time it does have to do with sex, but it also has to do with drug use, okay, so this is a big concern, especially for you guys at your age, okay. Scary fact here is many people go unaware that they have contracted the virus for 8 to 10 years, okay, and some of that has to do with lack of screening, okay. How many of you guys go to the doctor regularly and they do blood tests, okay? That's how you're going to find this out sooner rather than later, okay? Some people don't, and so they've lived with this disease and passed this disease along without even knowing that they have it, okay? And that's why our number can get so high, okay? So HIV is kind of the stepping stone to AIDS, okay? people that have HIV will end up developing AIDS, which is acquired immunodeficiency syndrome. Okay, that's what AIDS stands for. This is worst case scenario. Okay, at this point, your body has no protection against any type of bacteria, any type of disease. So that immune system is so shot that if somebody walks by and sneezes on you and they have the flu or something so simple and everyday, it can kill you because your body has no defense for it. It's used everything up. Okay, people can develop types of cancers because their immune system is so shot. Okay, AIDS is kind of the last straw. Okay, people who develop AIDS usually die within 2 years after it becomes AIDS. Okay, that doesn't mean people with HIV die in 2 years. Okay, people with HIV can live several years. Okay, but it is something that it's kind of usually the last stage is AIDS. And people can have HIV and it never develop into AIDS. Okay, it doesn't mean just because you have HIV that you're going to get AIDS. Okay. All right, so let's talk about some pathways. All right, remember in our last video we talked about what an open pathway is. Okay, remember an open pathway is any opening in the body, whether it's a wound or our mouth, that can get bacteria in it and it can lead into our body. Okay, things that we see a big problem with are accidental punctures. Okay, so I told you in the last video about coming in contact with a needle. Okay, scalpels. All right, using a scalpel and accidentally poking yourself as well. Broken glass and razor blades, okay? Big things are, especially with the razor blades, okay, and I hope none of you do this, but if somebody is shaving, okay, and they nick themselves, their dry blood is on that razor blade. And then you go and you use that razor blade and you nick yourself. You're taking in their bacteria and putting it into your body, okay? Definitely gross. Please do not do that. All right, if you learn anything from me, it's don't share razor blades, okay? Other types of open pathways is going to be the open cuts or the abrasions that we see in athletics, okay? Turf burns, all right? They may not be very deep, but they can still, they still are openings to your skin. Okay, so keeping them covered, washing things, all right, will help with that as well. Sexual contact is going to be a big one, okay? Unprotected sex is just asking for trouble, all right? Not only babies, but diseases, okay? Condoms help, okay, but they are not foolproof, all right, for anything. Anything like that, you are putting fluid in your body that does not belong there, okay? And that's asking to spread your disease, okay? So kind of keep that in the back of your mind. Also, indirect transmission, coming in contact with somebody's dry blood, okay? In sports medicine, it's always using gloves, okay? Laziness is not a good reason that you get a disease. Okay, so putting gloves on, keeping things covered, all right, just making sure that we're being as careful as possible. So there is an organization that's called OSHA, and OSHA stands for Occupation, Safety, and Health Administration. And what they do is they're responsible for keeping work environments safe and clean, okay? They work with different companies to help make sure that in the event of there being some type of contamination, things are taken care of, okay? In 1991 is when they came up with these blood pathogen standards, and it says if you come in contact with another person's body fluid, this is what you do. We wash it, we go straight to the doctor and get tested. And that's what happens in our exposure control plan here. And it is a step-by-step guidelines that say, step 1, rinse out the area. Step 2, cover the area and follow it all the way through until this process is finished, meaning you've had the blood test and you are negative, or if you are positive, you have to call people that you've come into contact with. It's a big whole long list of checklists of things to do, okay? And the big key thing with here is making sure that you're record keeping. If I get contaminated, who have I come in contact with? How did I get contaminated? Okay, it's a big key, because we don't want things like this spreading. All right, even something as simple as the flu virus. All right, we don't want anything spreading. So this exposure control plan is going to be similar to a crisis plan or emergency action plan that we're going to talk about in our next chapter. It's just step by step, like I said, to try to minimize the risk of spreading a disease or an infection to somebody else. Okay. You are, if you are exposed, and this is to anything, okay, we want to wash through the area thoroughly, okay. You guys know, like when you were in like your science labs and they have the eye wash stations, okay, same thing. All right, flush out the area. If it is in your eyes, all right, you can use saline solution. All right, or eye wash. Use it 20 minutes. All right, and it's a lot. Just keep going. Flush both eyes out, whether you just got it in one or the other. All right, you want to report the incident, okay, whether it's to a teacher, to your boss, an administrator, just depends, but make sure you've let somebody else know. All right, write down what happened, document where were you, how did you become infected. And you want to follow that exposure control plan to seek care, going to the doctor, getting tested, figuring out what your next step is. All right. To clean the area, you want to make sure that you disinfect all of your workspace, all right? In the training room, that means like we are cleaning the tables, okay? Keeping everything sterile, like countertops. If we set dirty gauze on the countertops and somebody comes along behind us and touches that, that's our fault that it wasn't cleaned up properly, okay? And to clean, you're going to use a solution of 1 part bleach and 10 parts water, okay? That is the basic solution. There's over-the-counter stuff that you can use, but that's the most recommended solution, 1 part bleach and 10 parts water, all right? And you're going to let it stand for 10 minutes, okay, and scrub the area good. So the last few things that we have is just things to help minimize contamination, the do's and don'ts of bloodborne pathogens, okay? Things that you do want to do, wear those protective barriers like gloves and goggles, face mask, anything that's going to help create an extra barrier between an open pathway and whatever contaminating fluid that you have, okay? Proper first aid supplies is a key, all right? And making sure that you follow any type of exposure control plan. Do's: use those protective equipment, all right? We've got the little suit here. We've got gloves and goggles, okay, masks, everything. But a big key is you're going to treat every body fluid like it's contaminated, whether it is your little sister, whether it is your boyfriend. All body fluid is contaminated, okay? Practicing good personal hygiene, keeping wounds covered, not sharing personal items, okay? Those are going to be keys. And the don'ts: please do not have unprotected sex, okay? You don't know what the other person has, okay? And you might not even know if you have come in contact with something, okay? You do not want to share needles, all right? Sharing needles is just asking for trouble, all right? Big thing here, especially in the training room, okay? Don't eat or drink around an area where there could be contaminated body fluids, okay? When we sit in the training room and we eat on the sweaty treatment tables, you're just asking for some type of bacteria, okay? Don't recap needles, okay? If you have to use a needle for something and you take the cap off, you leave it off, all right? And just don't show personal items, okay? Just remember to take care of yourself.